going on, everybody? Welcome back to the SOS Podcast, where we talk about sex and other stuff. I'm your host, Gabe and Gr8. With me always, my co-host, Gr8 Britt.
We are back. I think, is this the first time we're doing an episode like closer together? Is this like a double month or something like that?
I think between the Wrong Side of Woke and Pride Abuse, actually, that was like 2 weeks apart. So this is a little bit longer. But we've been
sorry. I thought we were coming at you more frequently. I guess it's all the one.
It's but you know, there are first times for everything. But it's been good. How you been since last time we talked? A lot's happened.
Yeah, I've been extra busy. It's ridiculous. It was like slam out of quarantine, and I'm just overwhelmed already.
It's a whole thing. Monuments are down. It's hotter than anal outside, and it's a whole thing. It's like 100 degrees today, and
the last like couple days.
Yeah, I know. I think it's supposed to rain tomorrow. Thank God. But anyways, we do have a first thing for this episode. Oh, also, shout outs to the health season and Feel Good RV for presenting this. Are you doing some events up at Bramley Park and everything? You want to shout that out real quick?
That's a good place to start because then that segues into the next. But by the time this comes out, it would have happened already. But we're approaching the second Live and Let Live, and this time it is at Bramley Park. If you're not familiar, it's a new winery. They are in Scott's Edition. They have amazing wines that they make and ones that are already made that you can get. But that's a shitty promo, but whatever.
Right. So, I mean, it's a promo. I guess it already happened when this came out. So, thank you for everybody coming out and showing some love.
Yeah, thank you. I really hope it was a success.
I heard the turnout was great. So yeah. Let's go and do it. But today is this show is also one more thing. Shout out to everybody who's been listening to the podcast at the SOS.
Yeah, I heard we've been getting some good reception from people.
Good reception. The Wrong Side is Woke. And just thanks for the love. And look us up on Instagram at _SOS_podcast. And you can send us DMs, send us your problems, send us your queefs, whatever you want to do. But
we love to answer those questions. It's my favorite part of the show.
Yes. We have some more later on, but first we have our first guest on ever.
Yee!
And,
first
guest. I'm really happy about this, and just give it up. It's our friend, and I don't know why I'm doing this horribly right now. You're like, we ran over a whole intro over. Anyways, give it up for physical therapist Matt Harville.
Hello.
Hey,
how's everyone doing?
Good. How you doing, man?
Doing great. Thanks for the invite.
We're so excited to have you.
So excited to have you. We have him there for specific reasons because we aren't just we aren't just comedy. We aren't just discussion, but we like to be educated over here, and we think everybody else should be educated as well. Because if you've listened to our podcast, you'd realize by now, I think half of our answers I don't know. So,
yeah,
it's good to be in the know. But anyway, so Matt, how are you doing? I'm just meeting him right now, folks. In case you know, so I just ask you a couple quick questions about yourself, just identity wise. So, how old are you now?
I am 31.
31. Okay, I'm
30 if you're not counting this year because of coronavirus.
Dude, I'm feeling the same way. I turn 31 next month, in 3 weeks actually, and I'm kind of I kind of want to be 30 one more year. This shouldn't count. Okay, so you're a physical therapist. Let's get into that. So, what are your patients like, and exactly what do you do in your field?
So, I work in the Richmond area. I work on the East End, so the lower socioeconomic class, which is really awesome to work with. Mm-hmm. It's really challenging, but also really fun, just really getting to know people. But I see a little bit of everything, really. I see mostly, for right now, orthopedic conditions, so knee replacement, hip replacement, shoulder pain, whatever you may have. But I've seen 5-year-olds all the way up to 90-year-olds. But mostly my interest and my specialty is in pelvic health. So that deals with urinary incontinence, fecal incontinence, pelvic pain, pain with sex, basically anything that your mama probably doesn't want to talk about in church.
Ah, the sex organs.
Pretty much.
And that's why he's on SOS.
And that's why we're here to talk about sex, and but that's a. So are we talking? So we're talking post surgery right now, or what do you, or just, well, I guess post surgery injury, but you're like you've probably covered all those things, right? Or
so it could be pre or post surgery for pretty much everything, really. So there's a lot of good research right now saying that if you get rehab before you get surgery, the outcomes after you get surgery are a lot easier and a lot faster and a lot better than if you just had rehab after you get surgery. And that's for most body parts. The knee, the most research is around the knee specifically, but there's a lot of good research right now coming out for other body parts as well if you get rehab before surgery.
Right. So what does rehab entail before surgery exactly?
It's a lot of education. I mean, even rehab after surgery and in general, it's a lot of education, a lot of teaching patients what to do, how to do things, mostly that they're okay. If they get some sort of x-ray showing that they have disc degeneration in their back, it's mostly educating that that's normal. If you go to Walmart, then most people at Walmart probably have the same thing. So a lot of my work is talking and just teaching patients how to do things. But, also we're physical therapists, so we do physical activity. So we do exercises, unfortunately.
Of course, we've all seen that guy, like, pretending to walk while he's holding on rails or whatever. I don't know, but
right. Much to everyone's chagrin that comes in, they have to do physical activity.
Yes.
So, I mean, that could be as basic as just squeezing a muscle and not doing anything, as up to doing plyometric exercises. It really depends on the patient, and it really depends on what they're going to be seen for. Gotcha.
So, like, so being in this field and dealing with this, not dealing, but helping those kind of patients. So there's a lot of, first of all, this type of surgery, there's a lot of risk going involved. And then afterwards, there's a lot of, obviously, education and learning that's to go along with a different chapter of your life, I'd say, because transitioning is like it's not a overnight process, as everybody knows,
Right.
So, like, go ahead.
I was just going to say that, like, there's a little bit of a dearth of research for transgender people and specifically for rehab. So kind of piggybacking on the fact that I do pelvic health. There's a lot of pelvic health therapists right now that are kind of delving into the transgender community. And there's a little bit of research out there about rehab before and after gender-affirming surgery, but it's very few and far between. But mostly beforehand, what we do typically is, one, education of what's going to happen after the surgery, the inpatient hospital stay, kind of the recovery process, things like that. But we also do our pelvic exam, our regular kind of screening the back and the hips and checking what their range of motion is and their strength and things like that. But the really important part is that pelvic exam, which usually we want it to be internal ultimately, but obviously it's up to the patient whether or not they want to do an internal assessment. So we can also do it external, which is just kind of seeing the muscles.
Okay.
So kind of that perineum, which is colloquially termed the taint, just kind of seeing how that moves, seeing if it contracts and relaxes. You get the most information from that internal assessment, which is a lubed gloved finger into either the rectum or the vaginal cavity and having them squeeze, relax, things like that. And that important part is to see if they have, one, good muscle tone of the pelvic floor, but also if they can relax. So after surgery, we want to make sure that we kind of lessen that urinary incontinence or fecal incontinence or pelvic pain. So it's good to kind of tackle that before they go into surgery. So that way that's kind of already dealt with and they don't have to deal with it more after the surgery.
Gotcha. So are more of the patients men or women? Is that a...
So it really depends, especially in that transgender community. It really depends.
Well, because the surgeries, I think correct me if I'm wrong, but the surgeries between the two, like the risk going involved is a little bit different depending on what you want. Is that a thing?
That is a thing, and it's more common to have that vaginoplasty, so that's male to female, than it is to have the phalloplasty, which is female to male, just because of that, the risk, but also kind of the things that go on afterwards.
Well, there's like a lot of nerve stuff that can go on,
that's correct.
Or it's not there.
I feel like I'm so ignorant when it comes to these surgeries. Like I like, that's just being totally honest. And to be honest, I feel like this is an important interview because there are so many others that are just as ignorant, if not more, so
I'm trying to get educated.
I mean, yeah, please. Like, I hope you don't mind, like, the hard questions. I don't know. I'm just...
Please ask away. That's what I'm here for.
Yeah, I'm just wondering. So like, yeah, so with the nerve.
But you just kind of dropped new terminology for the surgeries. Can you say that again?
Of course. So let me kind of start over here. So the vaginoplasty is creating a vagina out of the male identifying parts here. Mm-hmm. So what they typically do is kind of go in, dissect the skin of the penis. They leave the glands of the penis because that's going to end up being the new clitoris. Because the nerves that go to the glands of the penis are similar anatomically to the nerve that goes to the clitoris in a biological female, like that female at birth. So they leave that to create the clitoris, but they kind of dissect everything else to use as either the labia majora, or they kind of just get rid of that skin depending on the typical patient, how much penile skin they have, things like that. The coolest part is, well, cool being a kind of weird term because I'm a nerd.
It is cool to us.
Yes, yeah, it's fine. What's the coolest part about this?
The coolest part is they take the scrotal skin and they invert it, and they have to take out the hair. They take out the hair follicles, and that is the new vaginal cavity. So cool.
What? Interesting.
I think the coolest part, because I did not know that there was actual like clitoral stimulation possible. Like, so they can still, so after you've had, you said vaginoplasty?
Yes.
They can have normal, like, female orgasms.
That's the goal.
That's the goal. Doesn't happen every time.
Ding.
Right.
Welcome to our lives.
I mean, surgery is surgery, and I mean, like, first of all surgery is serious, but this is some serious surgery, and
it's a pretty lengthy surgery. It takes typically between 6 and 8 hours. So,
oh wow!
The patient is under for a while.
And what's the healing time normally?
That depends on the patient.
And are you
research?
How? Okay. I guess this is kind of like a layered question. So, like, physical therapy versus not physical therapy. Say, how long after the vaginoplasty can you walk right after? Like, is it like? I would imagine I just want to like lay down like all the time.
Yeah, and they actually educate patients